One of the most common conversations that I have at work isn't actually with my patients. It's with their adult children who are concerned about the changes that they're noticing with their mom. They'll tell me something like, I don't know exactly what's going on, but my mom just seems different now. And then when I ask what they're talking about, it almost always comes down to the same five things. And the interesting part of this is that my patient usually isn't even aware that these things are going on. The first one that almost always comes up in these conversations is that mom seems to be having more trouble on the stairs. When I ask what exactly they mean by that, they'll tell me that they've been noticing that their mom only leads with the same foot going up. And sometimes she seems to really have to pull in the handrail. A lot of the time, they'll even talk about how going down the stairs looks totally different, way less confident than it used to, and taking every step ever so slowly. And honestly, every once in a while, they'll tell me that they made their mom stop using the stairs at all because it looked so unsafe. While not using the stairs might sound smart in the short run, it's definitely going to lead to more weakness in the long run. And we'll talk later about how I address these issues with the stairs. Now, stairs are the most obvious thing you noticed and are eager to tell me about, since stairs can be fairly challenging at baseline, but also because everyone knows that a fall on the stairs never ends well. But then I find out they've also noticed their mom having more trouble standing up from chairs and couches. Now that's a fairly straightforward activity, so I'll ask what they're seeing to make them say this. And they talk about how their mom has to really push off with her hands and bend forward to come up to a standing position. Sometimes they'll mention that their mom only has one chair in the whole house that she uses because she doesn't feel like she can get out of any of the others. Now, this is very concerning to me as a home care physical therapist because even the smallest struggle to stand up from a chair is a step closer to losing independence. Since they've noticed these first two things, there's one more thing that always seems to go along with it when there are grandkids in the family. And without even asking, I've had this conversation enough times to know that they're going to mention it. And that's that their mom has stopped getting on the floor to play with her grandkids. She apparently did it all the time just a couple years ago, but now she only wants to stay on the couch and watch from there. Getting on and off the floor requires many different physical capacities at once, but above all that, it requires confidence as well. And it's the one place that most women in their 60s and 70s never want to find themselves if they can avoid it. And if that means no longer getting to play with their grandkids there, well, that's often the choice that they have to make. A lot of the time when I'm having these conversations with adult children, they don't realize how difficult something like getting down on the floor can be. And why would they? They see their own children do it pretty much all the time. They themselves can do it decently, and most people don't even think twice about it until suddenly they lose the ability. By this point in the conversation, we've talked about those dangerous stairs, getting up from chairs, and the floor. All things that are pretty obviously related to strength levels. But then they mention something that's a little bit different. And sometimes this actually gets mentioned first because it's what their mom complains to them about. They tell me she gets tired so much easier than she used to. And they're not talking about being tired from going out for 3-mile runs or taking hard exercise classes at the gym. They're talking about things like an afternoon running some light errands or maybe even having to watch the grandkids for a few hours. They usually think it's related to her medications or even diet and hydration levels. And once in a while, yeah, that can be true. But what I see more often than not is that fatigue and weakness, they go hand in hand. When basic tasks like going down the front steps or getting out of the car a bunch of times are challenging because of weakness, that shows up as general fatigue after enough reps. The problem here is that eventually these activities get avoided more and more, which only leads to further weakness. Speaking of weakness, there's one final thing that keeps coming up when I have these talks. Mom has trouble carrying her laundry. She wants me to carry her grocery bags for her. So that's laundry and grocery bags, the two things that life requires us to carry, and the two things that often expose weakness in many older adults. Leg strength, grip, core, carrying objects like this challenges it all. And many of these adults think that it's normal to struggle with these types of activities. They're getting older and a little weaker, so it just makes sense. Now, there is a point in when carrying a heavy basket of laundry can become difficult. But the patients I'm talking about are nowhere near that stage of life. Okay, if you look at each of these things by themselves, it might not seem like a big issue. People get weaker, so something like struggling on stairs or getting off the floor just seems normal. When I hear about these issues from adult children, I don't see 5 separate problems. What I see is one big problem showing up in 5 different ways. And that problem is a loss of strength. So, how do we address that? The good news is that strength is one of the most trainable qualities that we have at any age. Want to get better at stairs? Do some step ups and practice the stairs more. Want to get out of a chair better? Practice doing sit to stands every day. Can't get off the floor? Well, spending a little more time on the floor is a great first step because many adults spend almost no time there. And as you build this strength, you'll notice everyday activities become easier. Carrying groceries and laundry just feels better. Less fatigue on the day-to-day. Ultimately, you can believe that struggling with these 5 things is just going to be a part of normal aging. Or you can see them like I do, as strength that's just slowly slipping away. And the sooner you do something, the less worried your children are going to be, and the brighter your future will be.